Hello. In this presentation, we're going to be discussing obsessive compulsive disorder and related disorders. So, the 5 obsessive compulsive disorders that we're going to be looking at in detail are obsessive compulsive disorder, body dysmorphic disorder, hoarding disorder, trichotillomania, otherwise known as the hair pulling disorder, excoriation disorder, which is also known as skin picking. So OCD, or obsessive compulsive disorder, is an anxiety disorder marked by the reoccurrence of intrusive or disturbing thoughts, impulses, images, or ideas, which are your obsessions, that are accompanied by repeated attempts to suppress these thoughts through the performance of certain irrational and ritualistic behaviors or mental acts. This is where you get your compulsions. So if you have a lot of anxiety about getting sick and having germs, and that becomes an obsession, you may go through the process of washing your hands 30, 40 times a day because the compulsion to rid yourself of these germs is the only thing that can help you manage your obsession. The compulsion may represent a strict rule that the patient must apply rigidly in every situation. For example, always putting the right shoe on first. The obsessions and compulsions take up large amounts of patients' time, an hour or longer every day, and usually cause significant emotional distress for the patient and difficulties in his or her relationships with others. Again, being somebody who has this overwhelming compulsion to clean your kitchen does not necessarily mean you have OCD. It has to cause significant emotional distress for yourself and for those around you. About 2.3% of the population of the United States is diagnosed with this condition. The typical age of onset is late adolescence to young adulthood, with slightly more women than men being diagnosed with OCD. It is not the same thing as obsessive compulsive personality disorder, and that's where people often get confused. OCD is a different disorder than a personality disorder. The personality disorder is characterized by a lifelong pattern of insisting on control and orderliness and perfection that begins no later than the early adult years. However, somebody who has obsessive compulsive disorder, it's not about necessarily being orderly or tidy or perfect, but conducting these compulsions to help ease one's anxiety. It is possible, however, for a person to have both disorders. So the most common compulsions in Western countries include the following. And again, just because you do these things once in a while does not make you somebody with OCD. These are folks who do this repeatedly throughout the day in order to ease their anxiety. So, washing, cleaning, counting, always having to count everything, hoarding, and we're going to talk about hoarding in more detail in a few minutes. Checking if the oven is turned off, checking if the iron is turned off, checking to make sure that every door is locked. These people might go through a routine before they leave the house that might take them an hour to get out of the house. Putting objects in a certain order, so they have to have a pattern that exists to calm their anxieties. Repeatedly confessing or asking others for assurance. Repeated actions, things that people do over and over again that don't make sense. And finally, making lists. Just because you're a compulsive list maker doesn't mean you're OCD. Again, it's a difference between making lists that are functional and making lists without purpose. OCD is presently classified as a form of anxiety disorder. but current studies indicate that it results from a combination of psychological, neurobiological, genetic, and environmental causes. So there's a lot going into the stew pot, so to speak. So let's talk about the neurobiological differences. Some researchers have noted that people who suffer from OCD have also suffered a head trauma. And we've seen that head trauma, especially in the last few years as it has become more prevalent in discussions about sports, can change one's personality significantly. So again, this is not altogether unsurprising. Recent studies also using a positron emission tomography, otherwise known as the PET scan, indicate OCD patients have patterns of brain activity that differ from those of people without mental illness or with some other mental illness. So the brains are different. Using an MRI, researchers found that patients diagnosed with OCD have significantly less white matter in their brains than did normal control subjects. So, that kind of a scenario indicates that there may be some neural connectivity that's being lost. Large epidemiological studies have found a connection between streptococcal infections in childhood and the abrupt onset or worsening of OCD symptoms. So, having one or two strep throats in your childhood is fairly normal, but when you get strep all the time, they're finding a correlation. The general nature of OCD seems that it runs in families rather than the specific symptoms. So your mom might be OCD and be a compulsive hand washer. You might be OCD with a compulsive need to hoard things. So the concept runs in families, but the specific behaviors might be different. Body dysmorphic disorder is a condition marked by an excessive preoccupation with an imaginary or minor defect in a facial feature or localized part of the body. So, what they're doing is they're looking at their nose and they think that their entire face could be improved if they just got a better nose. The diagnostic criteria specify that the condition must be sufficiently severe to cause a decline in the patient's social, occupational, or educational functioning. In other words, what you have to see here is, again, a significant problem. So if you're a woman and you wish your breasts were larger and you would like to get a breast enlargement, that does not make you a person who suffers from body dysmorphic disorder. However, if you get a breast enlargement and it still isn't what you want and you then get 3 or 4 more surgeries, this could qualify you for body dysmorphic disorder. Body dysmorphic disorder can also be differentiated from the body image issues which define features of eating disorders such as anorexia or bulimia. In a distorted body image, it involves a preoccupation with the overall body weight or mass, whereas body dysmorphic disorder involves focusing on a specific part or feature. People with body dysmorphic disorder will undergo unneeded cosmetic surgery, dental procedures, or dermatological procedures to correct the perceived flaw, but are typically not satisfied with the results as this is an internal perception issue. The typical age of onset of body dysmorphic disorder is around ages 12 to 13, with the average onset being age 16 or 17. Now, the prevalence of body dysmorphic disorder is about 2.5% for men and 2.2% for women. If you look to the right, you're going to see one of the most famous examples of somebody who suffered from body dysmorphic disorder, and that was Michael Jackson. So in the picture at the top, off of his Off the Wall album in the late 1970s, he is a fairly dark-skinned, wide-nosed young man, very cute, totally adorable, And then below, you'll see a picture that was taken a few years before he died, where his face has been considerably lightened in terms of the skin tone color. His eyes are no longer round, but they're more oval shaped. His nose has been completely butchered, and he has a cleft being put into his chin. Theoretically, what researchers and doctors have theorized is that he had such a terrible relationship with his father, who was very abusive to him, that he went to great lengths to change how he appears because he did not want to look in the mirror and see his father's face looking back at him. So that brings us to risk factors, which include child abuse, sexual trauma, bullying by peers, and a serotonin imbalance or insufficiency. So in this case with Michael Jackson, you could pretty much identify the issues he had with his father. But again, this is a guy who had literally all the money in the world and found doctors who would perpetrate these surgeries, which clearly did not improve his looks. Then we get into hoarding. Now, for those of us who've watched the TV show about hoarders, it is something that most of us are just appalled and can't believe people act like that. However, this is a psychiatric condition that produces symptoms such as the compulsive urge to acquire unusually large amounts of possessions and the inability to voluntarily get rid of these possessions, even when they have no practical use or value. They experience feelings of anxiety or mental anguish whenever these possessions get thrown away. So, for example, if you have a bag of bags, everybody has a bag of bags that they, have picked up from the grocery store. And we use them to bring our lunch or take out the cat litter, whatever we're using it for. The point being is the vast majority of us would not be devastated if this bag of bags was thrown away accidentally. However, somebody with a hoarding disorder may be devastated and go through a deep, deep depression when something as minor as that kind of item gets tossed. Most affected individuals accumulate things with limited or no real-world value, such as old books, magazines, newspapers, notes that they've written themselves, outdated clothing, and old mail. The junk mail is a terrible problem for hoarders. They don't get rid of it. They just let it pile up. And this issue then becomes that it produces so much clutter that it limits or prevents the practical use of that space. That space that they have everything in, whether it's one room or the entire apartment or house, becomes completely dysfunctional. And in some cases, the collected materials produce an active, ongoing danger in the form of things such as a fire hazard or a hygiene hazard. If someone is collecting any number of old boxes, inevitably you're going to end up getting mice, you're going to get bugs, and you cannot control what is happening because you have so much stuff that as soon as you go to try and kill a cockroach, it just crawls under something else. The current population estimate of people who suffer from a hoarding disorder is approximately 2 to 6% of the population. And it's not something that we really see a lot because it goes on behind closed doors. And you might see a house that looks perfectly fine from the outside, but on the inside there's literally no functional space. Gender prevalence is unclear, often in men and women, so it seems to be about the same. And the average age is 50, although most people begin hoarding around age 20. And again, depending on the scenario that has created the anxiety, you might have somebody who grew up really poor and didn't have anything, somebody whose parents would throw out their toys. There's any number of reasons that somebody would start to engage in hoarding, but it's always going to be based on some level of anxiety. The functional impairment and clutter get worse with age, and there is support for both genetic and environmental factors. One of the big problems they have is decision making. They're very indecisive, and instead of getting rid of things, what they like to do is called churning, which involves moving things around without actually getting rid of anything. The picture on the right-hand side there is from the early 1900s, and it is based on a case in Manhattan involving two brothers, Homer and Langley, who were wealthy. They lived in a beautiful apartment in Manhattan, and one died because he got trapped under a cascade of newspapers. And so when the police finally had to show up to try and figure out what was going on, they couldn't even get in because the apartment was so packed with stuff. I believe from the news reports there might have been 5 or 6 grand pianos in their apartment, and they would sit under them or fill them up all the way around. So this is not something that's a modern condition. This is a condition that's existed for a while, but it's becoming more and more prevalent because we get to see it on TV on a regular basis. Then we have trichotillomania, which is known as the hair pulling disorder. It involves a recurring, irresistible urge to pull out hair from your scalp, eyebrows, or other areas of your body, despite trying to stop. It is a stress reaction. Hair pulling from the scalp often leaves patchy bald spots, which causes significant distress and can interfere with social or work functioning. Again, you see a gray hair in the morning and you pluck it. That does not mean you have this disorder. That just means you don't want to go gray at the age that you are. Instead, people with trichotillomania, they will pull out large chunks and they will work at certain spots over and over again. And they go to great lengths to disguise the loss of their hair, wearing hats all the time, doing the comb-overs, those kinds of things that you would normally see somebody who's naturally bald doing. For some people, trichotillomania can be mild and manageable, but for others, the compulsive urge is overwhelming. Now we're going to look at something called excoriation, or the skin picking disorder. This occurs in about 1.4% of people, with the vast majority of them being female. Usually begins during the years of puberty or your teen years because of acne, and the face, the arms, and the hands are often the go-to areas for pickers. But the DSM-5 does also note that picking can occur anywhere on the body. The targets for skin pickers include healthy skin, minor imperfections, pimples, calluses, and old pick scabs, which can be picked at with fingernails, which is the most common, or people like to get out their tools like tweezers and pins to really get in there and pick out stuff. You'll see on the pictures on the right somebody's hand that's been chewed up and picked to within an inch of its existence. This is a really dangerous issue for people who pick their hands because we eat with oftentimes our hands and they go into our mouths, and there is such a likelihood for infection in these particular areas. Picking can occur in short spurts throughout the day or for prolonged sessions. Some examine, play with, swallow the skin. It is disgusting, but it also, for the person who's engaging in this behavior, making them feel so much better about their stress. So how do we treat OCD disorders? Well, the best combination is medication and psychotherapy. Cognitive behavioral therapy is a type of psychotherapy that works especially well in treating OCD. So CBT teaches the patient different ways of thinking, behaving, and coping with situations that trigger obsessive thoughts and compulsive behaviors. And the type of CBT that's been found to be most effective is called exposure and response prevention, or ERP. This term, exposure, refers to the practice of facing the repetitive thoughts, images, and urges that cause the severe anxiety associated with OCD. So, for example, one of the classic exposure techniques that is used for people who have issues with germs and they go out of their way to wash their hands 100 times a day, they may be asked to bring their toothbrush in and they have to clean a sink with their toothbrush. And then, without cleaning the toothbrush, they have to turn around and brush their own teeth. And even though this sounds disgusting, it is in fact to demonstrate to the person that even in a worst case scenario, you can brush your teeth and you're not necessarily going to get sick. Antidepressants such as Zoloft, Paxil, and Prozac are often used, and then we've seen some great advances with using electroconvulsive therapy, ECT, or as it used to be called in the olden days, shock therapy. So there are all kinds of treatments out there for people with these disorders. So if you recognize yourself in any of these, you might want to get yourself to a doctor to get it checked out. So if you have any questions, please feel free to text or email me. Here are some great articles to read if you're curious about more information. And I hope you have a terrific day and a wonderful rest of this presentation.